Thank you, Ilya, and thank you, Roger, for putting this together, and thank you for reading that quote from the Washington Post. It sounds like an impressive quote, but they're just quoting me saying that, so it's really less impressive when you know the full story. Roger told me that I would have the honor of being the first person to really present here in Cato's new Hayek Auditorium. And I have to tell everyone who's going to follow me that the view from right here is fantastic. So let's jump right into the individual mandate, though. Last month, a USA Today Gallup poll found that 72% of Americans think Obamacare's individual mandate is unconstitutional. What's really remarkable about that is that 56% of Democrats and 54% of those who support the law as a whole think the individual mandate is unconstitutional and therefore illegal. And an Associated Press National Constitution Center poll has consistently found that more than 80% of Americans believe the government should not have the power to force Americans to purchase health insurance. Now, Obamacare's defenders will say that, well, voters oppose this law because they're confused. Well, of course they're confused. This law is 2,000 pages long. How can you not be confused? It is generating additional thousands of pages of regulations. The Department of Health and Human Services has so far issued 200 pages of guidance on how to draft a 4-page summary of health benefits. When they released their sample 4-page summary, it was 8 pages long. Everyone is confused about this law, but none more so than its defenders. Nearly every claim that they make about the individual mandate is a myth. An individual mandate, for example, does not make health insurance more affordable as they claim. It makes coverage more expensive by forcing consumers to purchase additional coverage that they do not want and may even find morally offensive. The mandate has already increased some people's health insurance premiums by as much as 30%. Before the mandate has even taken full effect, these aspects have already increased health insurance premiums by more than cost shifting from the uninsured does. So the mandate will not eliminate cost shifting from the uninsured, but even if it did, it would still increase premiums. The mandate does not reduce cost shifting, as it suggests. It increases cost shifting. One of Obamacare's leading cheerleaders is an economist named Jonathan Gruber. He's projected that when the mandate takes full effect in 2014, it will cause some people's health insurance premiums to double. Think about that. Think about how much you pay for health insurance right now. Think of that amount and now imagine doubling it. That's because the law will force a lot of healthy people to pay higher premiums to subsidize the sick. But that doesn't reduce the cost of covering the sick. It just shifts that cost to others. And as cost shifting always does, that leads to higher costs overall. President Obama has said the mandate and the rest of the law will save lives. The problem is he doesn't have any solid evidence to back that up. In fact, while Congress was debating Obamacare, researchers in Oregon were conducting the only study ever to generate solid evidence on whether broad-based expansions of health insurance saves lives, and the president and Congress couldn't be bothered to wait for the results. So far, that Oregon study has not found that broad-based coverage expansion save lives. And there's even less reason to think that Obamacare will, because Obamacare expands coverage to a group that is on average more affluent and therefore has a higher baseline access to care than the people in that Oregon study. President Obama has also claimed that imposing an individual mandate and the rest of the law shows that he cares. You may remember this when he embraced that term that we all use, ObamaCare. He said, I don't mind people calling it Obamacare. It means ObamaCare's. The underlying assumption here, though, is that Obamacare is compassionate and that supporting it makes you a compassionate person. Now, I want to warn any Obamacare supporters out there that what I'm about to say may sting a little. But if you were a compassionate person, then you would support whatever policy saves the most lives or creates the most financial security with the several trillion dollars that Obamacare spends. Just as there's no solid evidence that Obamacare will save lives, there's even less reason to think that Obamacare will save the maximum number of lives possible with the trillions of dollars that it spends. So in fact, Obamacare is not compassionate, neither are you if you support it, because by supporting Obamacare, rather than experiments that would show which policies save the most lives per dollar spent, you're revealing that you're willing to forego more life-saving uses of that money in order to get whatever other X factor Obamacare delivers to you, whatever other X factor it brings you. You're literally willing to let some people die who might have been saved by more life-saving uses of that money. But Obamacare's opponents have also advanced a myth about the individual mandate. Opponents will tell you that the myth is the centerpiece of Obamacare. It is not. The centerpiece of Obamacare is the set of government price controls that Obamacare imposes on health insurance. Price controls that tell insurance carriers they must charge healthy and sick people of a given age the same premiums. Healthcare wonks call these rating restrictions or community rating because they would rather the public not recognize them as price controls. Price controls are always harmful, but these are so harmful that the rest of Obamacare, including the individual mandate, can fairly be described as attempts to undo the damage that these price controls cause. For example, these government price controls are so destabilizing, they typically cause health insurance markets to collapse because they so dramatically increase premiums for healthy consumers that healthy people leave the market altogether. The market for child-only health insurance policies has already collapsed in 17 states and is slowly collapsing in another 17 states because Obamacare has already imposed these price controls on those markets. The individual mandate is an attempt to undo the destabilizing effects of these government price controls by forcing healthy people to pay Obamacare's inflated insurance premiums. The mandate won't quite do the trick, though, because millions of households won't be able to afford that expensive coverage and could still save thousands of dollars by dropping coverage and paying the penalty. So Obamacare's trillions of dollars in health insurance subsidies are a further attempt to undo the destabilizing effects of its price controls by bribing low-income people and healthy people to stay in the market. The employer mandate, in turn, is an attempt to keep the cost of those subsidies down by preventing employers from dropping their health benefits so that their workers can take advantage of those subsidies. But Obamacare's price controls don't just affect the healthy and create perverse and harmful incentives there. They also hurt the sick because they literally force insurance carriers to compete to see who can provide the worst coverage for sick people. If a certain type, think about it, if a certain type of patient costs $1 million to insure, and Obamacare tells insurance carriers they can only charge those patients a $10,000 premium, then what happens to insurance carriers who provide the best coverage to those $1 million patients? That insurance carrier will attract every one of those $1 million patients and will go out of business because each of those patients will bring down its bottom line by $990,000. Obamacare's price controls literally create a race to the bottom because they force insurance companies to compete to see who can provide the worst coverage to the sick. And they do that in the hopes, insurance carriers will do so in the hopes that the sickest patients will choose their competitors instead and bring down their competitors' bottom lines. Ian Pearl is a victim of Obamacare-style price controls. Shelby Rogers is another victim of Obamacare-style price controls. Their insurance companies competed to avoid them because they already operate in markets subject to Obamacare-style price controls. Obamacare includes more mandates and regulations and programs whose purpose is to stop insurance carriers from doing what its price controls force them to do to survive. Obamacare creates 3 separate programs that attempt to tax all health plans and subsidize those that get the most Ian Pearls and the most Shelby Rogerses. Obamacare regulates health insurance marketing, benefit design, network adequacy, plan offerings, each plan's service area, the amount that carriers spend on administration, all to try to prevent carriers from doing what its price controls reward them for doing. None of this will work any more than the individual mandate is going to work. The biggest of these programs is the so-called risk adjustment program. And as health economists Henry Aaron and Austin Fracht have explained, quote, insurers have been able to outfox the best risk adjustment algorithms. In all, I count at least 14 programs and regulations whose purpose is to fix or mitigate the damage done by Obamacare's price controls. So the mandate is not so much Obamacare's centerpiece as merely one of a cascading series of efforts to prevent the catastrophic harm that the law's price controls would inflict. And this brings me to what I think is the final and most brazen myth that supporters have peddled about an individual mandate. Specifically, that's the myth that an individual mandate promotes personal responsibility. And again, if there are any Obamacare supporters out there, this one might sting a little too. The mandate does not promote personal responsibility, it promotes personal irresponsibility. Obamacare supporters wanted to impose these sorts of government price controls on health insurance, the sort that causes health insurance markets to collapse, that causes insurers to compete to provide the worst care possible to the sick. Supporters could have taken personal responsibility for that decision. They could have launched their own health insurance plan that operates under those sorts of pricing schemes. Or they could have tried to restabilize the market, perhaps by personally subsidizing some people's premiums to try to keep them from leaving the market. But that's not what they did. Instead, they imposed a mandate that forces us to pay with our money and our freedom to fix a problem that they created with their price controls. So the entire purpose of an individual mandate is to enable supporters to avoid taking responsibility for their decisions, and I defy you to find a more brazen example of personal irresponsibility. Thank you.